My name is Priscilla Anyango, working at Texas Cancer Center, Nairobi. I'm a clinical navigator by profession. Uh, so in clinical navigation, what we normally do in oncology, this is where the patient is coming for the very first time. They are new. They don't know on how to navigate through the facility. So we pick our patient right from the reception. We take the patient, we take a token for them, and then they get to give us some of the details, the histology report and any other reports that they had before from the reception. So from there, they go to the cashier, they pay for the consultation fee. After that, we take them to the oncologist to see the doctor on duty, the oncologist on duty. Right from there, when the patient is having all the documents that are needed and qualified for us to get the treatment plan for the patient, either the patient is going to start radiotherapy or chemotherapy, we normally direct on, the first question always is, do you have SHA? Because you find not all the patients have SHA. So the ones who don't have SHA, we normally help them enroll in in the SHA, so that SHA can help them in paying some of the treatment. Like in Texas Cancer Center, SHA covers, if the patient is having SHA, SHA covers for chemotherapy, radiotherapy, CT scan, and also brachytherapy that we offer here in Texas Cancer Center. So either the patient is going to start radiotherapy or chemotherapy. These are two different treatments. So we normally sit with our patient down together with the caregiver. We get to explain the treatment plan to the patient, because these treatments, they have side effects. The ones who are doing chemo, they have side effects both to radio and even the brachy. So we normally prepare our patient psychologically. We explain the treatment plan. We explain also the side effects of the treatment, and even some of the things that whenever this patient is going through the treatment, some of side effects if they encounter, so that they can be aware of them. And when that one happens, our doctors are always on duty for them to be seen. So it's good to prepare them and also to tell them the process. So most of the time you find the patient is coming in, and the relatives, this is the first time in their family they are getting such a case. So it gets so difficult to even the caregivers, together also with the patient, to take the information and everything, to take the fact that the patient is having cancer. So we normally counsel both the patient and also the caregivers, whereby we give them the emotional support. We refer them to the right people. We have psychologists around, whereby they're always being seen. We value their feelings as well, and also some of the questions that they have, we normally answer them. The other thing also, the patient will ask you about the nutrition. So we have the nutritionist will direct them to the nutrition, where they'll get the explanations on what to eat and also what not to eat, because so many of us have heard when someone is having cancer, they'll tell you, a friend told me we shouldn't eat this. But in Texas Cancer Center, we have the nutritionists always. They'll always advise on that. When it comes to psychologically, you find these patients, the relatives, they don't know how to handle this patient, because as they continue with their treatment, they get emotional. They get so emotional sometimes, and handling them sometimes is not easy. So we normally advise the caregivers on how to be with them at home, and on also how to accommodate them around them. The other thing that we normally do is we have accommodation within the facility. where we normally accommodate the patients who are coming from far and they don't have accommodations within Nairobi, or rather relatives within Nairobi to accommodate them. We have wards within the facility to accommodate our patients for the chemotherapy, radiotherapy, and also for supportive care. Yes.
Don't forget to subscribe, like this video, and share it with your friends and family. Together, let's tell stories that make a difference.